chronic inflammation. Why do you become anemic?
So your body is attempting to sequester all of the iron, and like what's proposed is like an evolutionary attempt to take it away from any like bacteria or pathogens.
Okay.
Thus, you don't also have it for blood.
So how does it sequester the iron? So hepcidin. So let's talk about this because this is relevant for iron deficiency as well. So hepcidin. When do you make hepcidin? You could do. So let's build the classic little chart here. So we're going to build an iron level. We're going to build an iron binding capacity, transferrin saturation, and a ferritin. So first we'll do anemia of chronic inflammation or anemia of chronic disease. So what would you expect to see? What's your iron level going to be in anemia of chronic disease when you measure it?
Low.
It's low. But what's your ferritin going to be?
High.
Normal or high, right? So this is the thing, is that the inflammation is causing your ferritin to be high. In contrast, what's your iron going to be in iron deficiency?
Low.
Low. What's your ferritin going to be?
Low.
Correct, right? So ferritin is measuring your iron stores. If you have both of these going on at the same time, however, this can be really difficult to interpret. Generally speaking, it's thought that in the presence of iron deficiency, even with inflammation, that your ferritin will never go greater than 100. So if you have a mixed picture, you're still never going to have a ferritin greater than 100, but that can be really tricky.
Because they're losing antithrombin and just like these coagulant proteins.
So it depends if they have what type of CKD. If they have nephrotic syndrome and they're losing them, yep, that's one thing. What else? Sometimes their platelets don't work. Why not? Uremic platelets, right? And so they can actually have very small amounts of bleeding from uremic platelets. They can have angiodysplasias. So they can have a combination of the inflammation and low EPO state, which is causing them to have decreased production, but they can also actually have iron deficiency as well. And this is relevant because, again, when you have these mixed pictures, it can be really difficult to just look at their iron studies and to know what's going on. When we have advanced CKD and people are really significantly anemic and they have a mixed picture and you're honestly not sure, there are some things that we can give in order to help people make more red blood cells, like severe iron deficiency in a patient who's not going to be able to absorb it orally. So like in a young woman who's already told you that she's failed oral iron for, menorrhagia, or for a patient with a gastric bypass who's actually taking their supplements but is just not absorbing enough. You can do an e-consult just for IV iron. And so are you all familiar with the concept of e-consults, that you can put this in and it actually goes to a specialist who reviews it? So you used to have to refer to hematology, and then hematology would see the patient, then they would get them the IV iron, and the whole process took forever. They've streamlined this in a very, very nice way. And so you put in this e-consult for IV iron, a hematologist looks at the case, determines if it's appropriate. If they determine it's appropriate, and as long as you're making good decisions about who to refer, they usually will approve it. And then they set up the patient, and you never have to do anything about it. They go in for outpatient infusion, they get their IV iron, and they're done. It's really nice. And so this